So, meine Damen und Herren, es geht hier Schlag auf Schlag immer weiter. Es ist mir jetzt eine große Freude, eine Kollegin vorzustellen. Dr. Ich kann das richtig aussprechen. Dr. Malgorzata Meunier, Französisch, ich kann kein Französisch. Sie spricht nicht gut Deutsch und deshalb wird sie ihren Vortrag jetzt in Englisch halten. Ich denke, die meisten werden hier folgen können. Der Titel steht hier an der Wand, State of the Art, Medicinal Cannabis and its Dosage Forms from Compounded Medicines. And she told me, in a little discussion which we had over there, that she had already a talk here on this platform 2019.
This is surprise.
Huh?
This is surprise.
Oh! Okay, she will start. It's you. You
Yeah,
have the clicker?
I just need the... So how it's working? Okay. Okay, so guten Tag, I'm sorry, my German is not enough fluent to speak German, so I will do it in English. So I will start very shortly about myself. So I was born in Poland and spent most of my life in France, where I was studying in Faculty of Pharmacy, formulation. Then I moved to Switzerland, to pharmaceutical industry, where I was spending almost 10 years in formulation of pediatric drugs and generally OTC drugs, prescription drugs. In 2017, I had the chance to move to Israel, and this was the country where I discovered medical cannabis. I spent in this domain, which is very different from pure pharma, 5 years. And the beginning of this year, I moved from Israel after 6 years to Germany, to Munich, and I'm currently a Chief Strategy Officer in a German company, Hapa Farm. Very shortly about Hapa Farm. Hapa Farm is a vertically integrated cannabis company. So the headquarters is in Dortmund, in Germany, but the extraction facility and also cultivation facility is in North Macedonia. So both facilities were inspected by German authorities and are fully certified EU GMP. So Hapa has a portfolio of medical cannabis products. If you want to learn more about our products and services, please kindly visit us on our booth. I would like to focus here on some different topics. So introduction, I should surprise you, but it was already told, I'm sorry. Yes, I was here almost exactly day by day, the same date in Düsseldorf, also speaking. And I will tell you that it was the moment when the Expo Farm opened first time for medical cannabis. So it was still a very immature market in Germany. And, this very pharmaceutical conference opened for this almost recreational taboo topic. At that moment, there was no companies in pharmaceutical cannabis field. The doctors were very intrigued by medical cannabis, but they didn't know how to prescribe it. So we could feel that there was the need for the education. And the pharmacists, they were completely new to the medical cannabis because there was only few pharmacies having a dispensation of the medical cannabis. So at that moment, I was working for another Israeli pharmaceutical company, and we were bringing the innovation, not only to this Expo Farm, but mainly to medical cannabis industry in Germany. So we decided to organize the big workshop in the closed room. We had the confirmation of 41 pharmacists who were just interested to learn how they can dispense, how they can formulate a compound, the medical cannabis. The room was completely full. I remember exactly those are 2 slides which I was showing 4 years ago, proposing to the pharmacist the full assistance in entering to this compounding miraculous world of medical cannabis. So we explained that we'll bring to Germany certified EU GMP intermediate or API. which will be then formulated by pharmacists with the excipients to obtain various specific galenic forms, like oils and tablets. We also were informing that we will bring the full assistance. It's mean the rental of the equipment, qualification of the equipment, support in the documentation, training, and all other headache from documentation administration part. So as you can imagine, the interest was huge at that moment, and we as a first company were offering this kind of big service and assistance to the pharmacist. So the collaboration proposed by the leader in pharmaceutical medical cannabis at this moment was like to doing downscaling. Okay, we have a finished product which is in Israeli and other markets, and now we have to bring this product to the compounding. So how we are doing, we are downscaling. We are decomposing this product, so we have to take out obviously all the excipients, which are functional excipients very often, and then the pharmacist has to recompose the product under compounding formulation steps. Obviously, as you know, there is this headache with all the analytical methods, equipment qualification, identification of the excipients, which the pharmacist is using during compounding, and also the paperwork, quality, documentation, and batch records. So we, as this pioneering company 4 years ago, we had this experience because this is the real life of pharmaceutical world with the industrial. And then it was the pharmacist who was facing these steps in his pharmacy. And also another model, not only to the pharmacists, but the company proposed to support the doctors. So how? Bringing the education, bringing some supportive product data, as you can see, for example, the pharmacokinetics data, then indication, titration model, and also dosage. So it was kind of a full platform of support to pharmacists and also medical doctors in Germany. It was in 2019. So 2019, just a reminder, because it was 4 years ago, there was only few flowers in the pharmacies, in few pharmacies. There was only few extracts, which were diluted, as you know, for the oral sublingual use. There was very limited number of pharmacies. Only big pharmacies could have medical cannabis, and obviously limited number of doctors prescribing medical cannabis. Also, what was new, it was the process of prescription. So all the complexity for the doctors, and the most problematic taxation process and additional fees for the pharmacist because he is formulating. Yeah, I'm sorry, and regarding the patient's reimbursement, because also it was very new and unclear process. And at that moment, obviously, we had unmet patients' needs because we had few flowers, we had few extracts, and there was no classic pharmaceutical formats. So today we are 4 years later. So as you can see, there is a lot of companies offering pharmaceutical medical cannabis. The pharmacists, they are here on stage sharing their own experience in their pharmacy. So you can learn from their experience, from their mistakes, from their headaches. So you have example to follow. You have multiple companies proposing you the services. So helping you in the bureaucracy, but also in analytical services, and everything which was like improved during these 4 years. And we see that the doctors are coming to the booth, to the medical cannabis companies. The pharmacists also are coming, still searching for these innovative formats. And obviously we have also the debates, where is the place of medical cannabis when the recreational market will come. So just the few points from current market of medical cannabis. So in 4 years, what changed? So from few flowers, we went to more than 200 type of flowers, different cultivars. You have from few extracts, more than 100. You have one purified extract for inhalation, so yes, there is some innovation. And excipient kits. It means that some companies were very innovative, bringing the set of excipients to helping the compounding for the pharmacies to use it with any from this 100 extracts and propose the finished product. We know also that there's multiple pharmacies existing in the market. It's a good business, especially when you are repacking the flowers, because the taxation is very interesting. And the doctors are also more confident and less skeptic for the prescription of the medical cannabis. Why? Because they were also assisted on the process of the prescription with the different applications, the digital health, and all other tools. And there is a few very big innovative pharmacies proposing the new galenic forms, so they are doing these tablets or capsules. Sometimes they have even their own extraction equipment. But still, it's very few pharmacies in whole Germany after 4 years. And patient needs is still unmet. So what went wrong? Because again, I was here 4 years ago and I was explaining how we will be innovative, how we industrial partner will bring this classic galenic form, innovative galenic form to improve absorption, to improve bioavailability of medical cannabis compounds. So I think that we did everything as we should, because first of all, when you are doing mistakes, you are also learning. What is important is this trio collaboration between patient, physician, and pharmacist. Why? You know very well that everything is coming from the patient. So patient, or by himself, who has specific indication, specific condition, so he's motivated to search for medical cannabis use, or he heard from family or from forum or the friends. Or himself, he tried in parallel market, for example, using recreational cannabis. And he has some perception of medical cannabis. Then he's meeting he has a concept, which kind of product he would like to have. Like, for example, he knows that he's, I don't know, there is the patient with palliative care or pediatric patient, so they would like to have suppositories. Then he can bring this product concept, I mean concept, not like a technical conception of the product, but just a need, confirmation of need to the doctor. Then doctor, obviously, he's not a formulator, but can have this exchange with the pharmacist. And then the product request will arrive to the pharmacy, to the receptor, to the magister formulation. And then again, if the pharmacist has enough skills in formulation or the equipment, or he's collaborating with pharmaceutical company, assisting him, forming him, he's able to release this new product to the market with the new specific delivery form. And obviously, then once the product is on the market, we have to have like product acceptance by the patient. Because if, for example, product is not palatable, or the tasting bad, or for example, side effects or dosing is not correct, or the side effects are persisting, the patient will not accept the product, will reject. So what are the patient's needs? So from our perspective, also from other markets, when we are delivering the finished product, because you know that in Europe, every country has different regulatory approach to the medical cannabis. Some countries, more of countries, has a magister formulation, but some countries has a finished product. So we know that the product design depends on the target patient. So example is pediatric and geriatric patients who has a problem with swallowing, so they cannot have, for example, solid forms. They are very well with the liquid forms. But palliative care patient, they should have a strong doses of the easy to deliver products like suppositories. Then patient complaints is very important. You have medical cannabis have very important and unpleasant taste and smell. So this formulation on the product compliance is very important. And also all the delivery technology which are adjusted to the delivery route. So if you would like to propose to the patient mucoadhesive patches, you can use it also for example, for the vaginal or rectal application. And pharmaceutical industry with all the delivery forms are targeting obviously better availability absorption. So this is like, and obviously I'm sorry to allow accurate the dosing. So this is something which exists in the pharmaceutical world. You can see in all OTC drugs, but it's still not applicable for medical cannabis, especially here in Germany under compounding. But why? I'm sorry, before why? We, like our company, but there is also various leading company, pharmaceutical company in Germany, proposing these very innovative products. Like we have nanogradient powders, we have mucoadhesive buccal patches, we have different SMEDs and sets, all the self-emulsifying systems, as well as water-soluble forms, or recomposed drug device product under receptor. Everything is ready to be scaled to the pharmacy. But we are facing, like industrial transposition challenges. The transposition challenges is, again, it's complexity of down scaling. Everything can work, this technology, for example, for mucoadhesive patches can work very well in full scale, in industrial scale. But if you have to go to the small scale of the pharmacy lab, it can be sometimes tricky or impossible. In the pharmacy, there is still limited equipment or lack of the equipment. Not all pharmacy can have very elaborate equipment, like for the emulsification. Obviously, you all know that you have to do identification method, not only of THC and CBD, but all excipients you are using. So if you would like to use specific polymers, you have to invest in the new development of analytical method for simple excipients. So it's a lot of time, a lot of money. And sometimes very contradictory regulatory status of delivery device. Or sometimes it can have status of medical device. Sometimes it can have a status of primary packaging. So it's really depending of the local authorities' interpretation. So the pharmacist can be lost, for example, if he can use some specific packaging as a simple packaging, or it must to be declared like medical device. The company has to bring full API stability studies, so it's also very important points. And for the finished product, which pharmacists will compound in the pharmacy, the in-use studies must to be performed. So it's also something which takes time and money. Process validation is extremely important, and all the batch records, which are the classic requirement of GMP standards. So the deadblocks which we as industrial, few companies, and having my experience in medical cannabis field from 5 years, which we identified, is equipment, process validation, analytics, and all the stability data which a company must to generate to assist pharmacists require a significant investment. And the pharmacist himself has no incentive to invest such a fund in the collaboration with the company, but also from his part in buying the equipment or elaborating an analytical method to invest because of the lack of taxation model. For flowers, we understood, and for the liquids, extract also, it's very simple. But as soon as you are bringing very innovative format, there is no clear taxation model. Sometimes even pharmacists can lose money. So there is no charity approach for the patient if there is no possibility to have enough revenue on this product. And obviously the industry, we were very motivated 4 years ago. We are not alone now. There is a lot of competition, and all these companies really proposing very innovative solutions, very innovative formats. But by the end, pharmacies can use this technology with any other API, any other extract. As I was mentioning, there's 100 different extracts. So why the pharmacist should use my technology with my extracts? So how we can break these deadlocks? We found only 2 solutions after these 5 years in European medical cannabis market. First of all, new taxation model to compensate pharmacists for such investment. So to allow to bring these new formats, which will increase absorption by availability, so increase also patient compliance and guarantee this uniformity of dose and dosage, which medical doctor would like to control when he's prescribing medical cannabis. There should be specific model for these new formats. It's also related to the reimbursement for the patient. And the second point is like IP protected technology that cannot be used for the generic. So something which is really the company who invested in the collaboration with the pharmacies, bringing these innovative formats, should be somehow protected to do not be replaced by the generic products. Final thoughts, very, very simple, and I was talking with my ex-manager who is sitting there today, and he told me to do not be too negative. I am not too negative. I'm still in this industry after 5 years, and I think that we have a lot to do together, like between pharmaceutical industry and the pharmacies. But the situation is as it is. I should be here to explain you our very innovative products which we have, and there is the huge potential. And again, you will be all enthusiastic, and maybe 4 years from now we will not bring anything because of the same problems. So I'm not negative, I'm just stating that it's a very difficult because of the current situation, regular situation of compounding, and the lack of the clear guidelines for the reimbursement, and also for the taxation such a product. So magister formulation in pharmacy is very important. It can allow to patients to have modern galenic formats. We can target specific patient groups. So, you know, this medical cannabis treatment is very close collaboration between patient and medical doctor, especially when we are doing titration. So if we have, for example, the patient from epilepsy, the small kids, you don't want to propose them to have bitter extracts, which the drops cannot really be controlled. And mom, when she's distributing the drops, can sometimes put 3 instead of 1. So the compounding is really permitting to the medical doctor and to the pharmacist offering such a specialized product. The quality control is essential. We in pharmaceutical industry, we have GMP standards. There is some standards GPP in the pharmacy, but it's a big headache also from paperwork and qualification of the equipment and analytical method for the excipients. Again, I'm insisting on the collaboration between patient, doctors, and the pharmacists. So luckily, we have now digital tools. We have a few applications existing in Germany, which allow doctor to follow up with the patient, declare the side effects, and also to use the specific titration for the products. I will insist the support and the presence of pharmaceutical company to the pharmacies is important. I hope that I will see you next year here with some new launches of the product in the pharmacies. And again, taxation, here we don't have any influence. I hope that the local authorities will just understand that this part of magister formulation receptor is very important to allow the innovating product to come to the pharmacies. This is what I wanted to say. It was not negative, just to tell you that I was here 4 years ago with the same topic, and not really a lot of new products arrived to the pharmacy. Thank you very much.
Thank you very much. Yes, I agree. I mean, this wasn't at all negative.
Thank
it
you.
was a fair talk, I would say, and it showed one of the many problems with this community, which we are just seeing this year, especially, and we are in the course of a new legislation and all these things. It's all on a certain way, a certain path, and nobody really knows how this will end. But
Exactly.
but I think it's very important that you care about compounding in
Yes.
the pharmacies, and that you showed us, you know, how complicated this is if you really follow the rules which should be done, especially with such a potent drug, I must say.
I would be happy to tell you that it's because of COVID we couldn't bring the product to the market,
Okay.
but it's not true. It's because of the COVID we didn't have Expo Farm during the last 2
That's right,
years.
yeah.
But it's really related to the complexity of the current regulation. So
Yeah.
maybe one day we'll move from magister formulation to the finished product in Germany.
Yes. Gibt es Fragen? Sie können die Frage ruhig auch auf Deutsch stellen. Ich glaube, die Kollegin kann so viel Deutsch und sonst übersetze ich. Sieht nicht so aus. Wir sind auch gut in der Zeit und thank you very much for this nice talk and good luck. Probably in 4 years' time.
For the good news. See you next year for the good news.
Next year, okay.
Okay.
Thank you very
much.
much. Okay.